My name's Brianna. I have finished my occupational therapy schooling and I am now a registered and licensed occupational therapist. And so I wanted to make a video about what I learned in OT school. I'm in a bathroom. I had an apartment fire, so things are a little out of sorts, so sorry for the echo. But the reason I wanted to make this is I know when I was originally planning on applying to occupational therapy schools or going through the process of thinking if I wanted to, I really didn't know what I would learn in OT school, like what that set of coursework would look like. And so I knew that I liked the idea of the end result, but I was worried I might hate the coursework involved. You know, doing a master's program and learning about things that you don't want to learn about would be really unfortunate. And also, I just had a lot of anxiety around the concept of applying to something that I didn't really understand. And so I've made a bunch of videos about my OT school process, I guess, to try and help out with that. And I figured this one might be a good addition. I have a list of like a bunch of different things that we learned about, but they're very generalized because, of course, I can't boil a whole OT degree down to a short video. But I think it might be a good place to start. And of course, I've probably forgotten some things, but something's better than nothing. So I'm gonna go kind of in the degree of which I learned things, but that might mean that it doesn't quite flow as nicely, but you get the picture. So we learned about professional development. So that's after you finish school, mostly continuing to do things to make sure that you're on top of what's happening in the field, and that you're not stuck in things you learned that might be outdated. We learned about advocacy and how to go about that, both for our clients and for the profession. We learned about OT theory, which I didn't really understand before I started OT school, but it's just ways of thinking about assessing your clients mostly. My favorite is PEO, and it's a very simple theory. And it's just that there are three circles: one's the person, one's the environment, and one's the occupation. And the more they overlap, the more that the person's going to be able to do the things they want to do. And the less they overlap, the less likely they'll be able to do that. And so when you're assessing a person, you're trying to figure out how you can help these things overlap better. Then functional anatomy. That's just the anatomy most important to your day-to-day function. Functional activities, I guess I should say. So the anatomy and OT would need to focus on. We learned about activity analysis. That's breaking down tasks into smaller and smaller bits, which is really helpful for when you're trying to figure out exactly what area in something someone is struggling with and then how to tackle that. Upgrading and downgrading, which is systematically making things easier or harder to challenge a person and work them to the point you want them to be. Developmental milestones, common equipment used, and how to go about training someone to use that successfully. Transfer training, which a transfer is just moving from one place to another. Vitals, so blood pressure, heart rate, how to take them, etc. Emergency management, goal setting and writing. A huge part of being an occupational therapist is setting goals and measuring them. Applied neuroanatomy, that's just, again, the neuroanatomy most relevant to someone's day-to-day function, which was very intensive. I think that makes it sound like it might be less, but I think there's a ton of neuroanatomy and then there's a ton that is relevant. picking, making, and using assistive devices, health literacy interventions. So someone's health literacy is how well they are able to understand concepts about health and the medical system at large and how they're fitting into it. And so we work with a lot of people who might struggle to understand what's happening. And so you need to be able to tailor your interventions to ensure that they're able to get the most out of therapy. Orthotic selection and making, which is really fun. Strategies for making successful group therapies and running them. I did a whole group therapy session on building forts that I ran with my classmates, which was really fun. Strategies for managing difficult behaviors, picking and giving assessments, which is a huge part of OT. Reading, using, and conducting research. We tended to focus more on qualitative research, but we learned about both. Medicare and Medicaid considerations, laws, levels of care in the medical system, so nursing home, hospital, all the different places somebody might go, fall prevention and assessments, mental health crisis assessments and interventions, sensory assessments and interventions, medical terminology, adult medical conditions, and specific things that you need to make sure you address in therapy, pediatric medical conditions, and things you need to make sure you're addressing, working in schools and common conditions you might see, considerations for treating those with hearing and vision loss, a lot of stuff about other specialty areas of practice that I just couldn't possibly touch on. So we had a whole lecture on specifically driving rehabilitation and all of the things that go into that. Discharge planning across the various settings, laws that are relevant to settings we might work in, CODA supervising. So CODA is an occupational therapy assistant, and as a OTR, you have to supervise them, which looks different and has a bunch of legal framework that you need to know about. Ethics and certain ethical dilemmas you might run into, independent contracting, program development. So if you want to set up a program that takes grant funding, how would you go about doing that? And often these programs are things where people aren't using their insurance. You're not taking insurance, you're using the grant to be able to pay for things. And then telehealth considerations. And like I said, there's a ton more that we covered, but I think that's a good idea of some of the core things you might be learning about to give you a reference of if you feel like occupational therapy school would be something that you would enjoy. I also felt like something that would have been helpful for me is kind of understanding that in OT school, they often don't outright tell you if patient has X condition, you're going to do Y assessment and treatment. It's more that they give you a really wide set of knowledge about a ton of different things that you might encounter. And then when you get into clinicals, your field work, you practice and hone your clinical reasoning to take all of these things you've learned and figure out what is the right set of knowledge you're going to pull from for the patient you're seeing at the moment, and their various diagnoses. And also in clinicals, that tends to be where you learn more of the specific documentation for your setting, because they just wildly vary from setting to setting and they change over time, and so it doesn't make sense to deeply cover it in school. And then also specific interventions, which also change over time. It's also very setting dependent, what you have there with you, and it takes a lot of creativity. And so we do talk about some specific interventions in school, but often we're talking about components of interventions. So with sensory integration, or I guess sensory therapies, you might know that somebody might benefit more from this type of movement versus this type of movement. And so you'll learn that in school. And then when you go out into the field, you're going to look at your surroundings and figure out how to incorporate that type of movement and how to make therapy activities out of the things that you're trying to address. So I hope that's helpful. And if you want to, you could check out the other videos if you feel like they would be helpful for you in OT. There's definitely more about, or in your OT process, there's more on my fieldwork experience, which I know a lot of people have questions about. And I'm not sure if I'll make any more about working as an OT. That can get a little more tricky, but we'll see. And have a good day.